Thank you. I'd like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to the elders past, present, and those emerging. Thank you.
Thank you, Catherine. Welcome, everyone. Thank you very much for joining our first webinar for 2022. My name is Bruce McFarlane. I'm the CEO of BlueRock, and I'm also the Managing Director of BlueRock Law. For those of you who are new to BlueRock, we describe ourselves as an entrepreneurial advisory firm. So what does that mean? So we've got a professional services part of our business. So we've got an accounting firm, a law firm, wealth management firm, a finance business, and a number of other businesses, about 250 people. And we've also got an investment part of our business. So we co-own and we co-locate with a number of businesses across retail, technology, hospitality, and a number of others. Some of you joining today. Thank you very much for joining. For those of you who want to turn your camera on, great, that'd be fantastic. We'd like it really to be interactive today. So we're not going to have PowerPoint presentations. It's really a Q&A format. And so, as you know, we'd like as many of you to engage in this, and we can, I'm going to throw to the audience and ask questions. So people that I know, get ready, because I am going to ask you questions as well. So look out, you'll be part of the show. So today we're talking about COVID. So who would have thought 2 years ago that we'd be still talking about COVID? Not me at all. Webinars as well. It's great that people are still joining webinars. 2 years ago, I hadn't actually run a webinar, and I think I've run about 100 JobKeeper webinars and a number of others. So, we're still doing webinars, and maybe that's something that will continue on as a result of COVID. But I guess COVID and the pandemic generally, and just, is affecting everyone. So personally, I've been in lockdown for the last 2 weeks because 4 of the 6 of my immediate family have had COVID, my 3 of my kids and my wife. So that's been a bit of fun, being locked at home during the summer holidays. At work, it's also, we've got Sabrina on the call, and I think we've probably had about, 20% of this people have tested positive over the last couple,
10 to 20.
So. Yeah. So there's a number of us, and so what that means for us as a business is who's in the office and who's not in the office. People are predominantly working from home, but it's also affecting, how we're interacting with our clients, and also, how we're getting the job done, who's available and at any one time. So and I'm sure that's going to play out, as the kids go back to school at the moment. It's already playing out for lots of people with kids getting COVID now. So, but what we're here to talk about today is really about how it's affecting you as business owners and how you can manage your business. So we'll talk about managing the vaccine mandate, creating a safe environment for your people, managing your employees when there's difficult things and difficult conversations, and then probably later managing claims and disputes with employees. So we'll look at all those things. We've got Catherine Stevens, who's an Associate Director in our employment team. Catherine's had a fun January dealing with lots of these questions, and we've got a lot of questions that she's dealt with for some of our clients over the journey. And Sarah Vincenzi is a Senior Associate also in our law team. So welcome, Catherine and Sarah. Thanks for joining us today. So yeah, as I said, we're going to do a Q&A format. So we're going to run through some of the key areas. If you've got questions, love you to raise your hand and ask the questions. Alternatively, if you are, having your lunch and you don't want to jump on the camera, also feel free to pop it in the chat, and I'll run through those questions and put them on the list with Catherine and Sarah as we go through the session. We'll also send a link around. So we're recording this. We'll send a link around. For those of you who weren't able to join today, and I know there was a couple of people I spoke to that couldn't join, but are going to get the link later on. And for all of you, if we don't cover the things today in any detail that you've got, or you've got things that are specific for your business or your industry, feel free to reach out to Catherine or Sarah afterwards. You'll have their email, their contact details in the information we send out tomorrow. What we're not going to cover today, though, is we're not going to run through all the government rules for all the different states. We know that you can access those through websites, and I'm sure you've been doing that for the last 2 years to work out what you have to do and whether or not you have to wear a mask in your office, and what requirements in relation to when people test positive and all that sort of stuff. So we're not going to do state-based stuff. What we're going to do is focus on the areas that are troublesome for business owners, and they're really struggling with, to try and figure out how to manage those. But if anyone's got things that they'd like us to cover specifically, please throw it in the chat and send it out. But I might go to you, Catherine, first. And one of the things that's still a live topic for businesses is, can you require your employees to be vaccinated? And if so, how do you do that?
Sure. Thank you, Bruce. Hello, everybody. It's nice to sort of meet you all. I am the Associate Director of Employment Law for BlueRock, and I'm looking forward to helping as many of you as possible. And look, COVID has presented huge challenges for employers across Victoria, well, across the country. And one of the sort of hot questions still is whether or not you can require your employees to be vaccinated. The short answer is probably yes. And like with all areas of law, there's always exceptions to that. However, it's generally accepted now that employers can direct their entire workforce to be vaccinated. And where it's tricky is only in fulfilling the requirements up to the point where you give that direction. So if you saw in the news, several large businesses, BP included, tried to mandate vaccination for their employees and fell foul of Fair Work Commission, it wasn't because their direction was invalid or unreasonable. It was because they hadn't followed the right process beforehand. So I won't get too bogged down in all the details, but the process generally is you've got to work out whether or not it's a reasonable direction in the current climate, and with the current government mandate about vaccines, it is. And then you need to consult with your employees about the proposed direction. And then those consultation requirements can sometimes be set out in enterprise agreements. But otherwise, you just need to consult with them, take on board their thoughts. Just because you might have one or two who say, no, I don't think we should be vaccinated, that doesn't defeat giving the direction. You then need to give the direction, and it needs to be given clearly and specifically. So it's probably not enough just to have a policy. You need to have drawn it to the attention of the employees, and that's best done via written communication. And in that written communication, it's really important to explain what happens if they don't get vaccinated, because that then sets you up for being able to manage that situation should it arise. So the short answer is yes, you can, and we can certainly help in terms of the sort of boring part of that, which is the documentation and the policies and that sort of thing.
So that's great, but what about if they still refuse to get vaccinated?
Well, if you've done the right thing and you've given them a reasonable and lawful direction, then their failure to comply is essentially a breach of their contract. So any kind of lawful direction that's been given by an employer and an employee fails to follow is in fact serious misconduct. But before we get to the point of giving the employee the marching orders, there's a process, because lawyers love processes and so do the courts. The process is that you need to basically take the employee through the same sort of process that you would for, say, performance management or misconduct of any kind. That is, you write to them and you say, look, these are our concerns. You give them an opportunity to respond to those concerns. And then you discuss with them the possible outcomes. In this case, it might be, look, if you don't get vaccinated, you have to be terminated. And you ask them to give their response on what they think about that outcome. It might be colourful, the response, but you need to consider it nonetheless. And then you can impose the outcome. Now, in terms of a direction to be vaccinated, it's a pretty black and white situation for the most part. Either they get it or they have a medical exemption, an approved medical exemption not to have it. If they fail to comply and they don't have that exemption, then you are entitled to terminate their employment, but as long as you've taken them through that process. When you skip steps in that process, that's where the risk arises in terms of unfair dismissal claims, general protections claims, and discrimination claims. So you sort of got that sort of trifecta of risk. So it's an important process. And again, it is a document heavy process, but that's because that's what the Fair Work Commission, for example, demands to ensure that the process has been fairly undertaken. And again, that's something we can certainly assist with.
So with that process, so obviously this was coming up a lot in November, December last year when this all came about, and some people were thinking, letting people wait and see what happens. And I know lots of people in lots of businesses were sort of doing that. And so if you didn't do anything at the time, so you sort of just let it slide and thought, oh, let's just see what happens in January. They're going to change their mind. Does it matter that you didn't do anything when it first happened? You can still turn around and still terminate the employment if in March or February they're still not back in the office, and you need them in the office to do their job.
Yeah, there's nothing fixed about it, particularly like as we've seen with COVID itself, there's nothing fixed. It constantly evolves and it's constantly presenting new risks and therefore new risks to health and safety. So when those mandates were first announced and the vaccine rollout started, it's understandable that people may have wanted to take a bit of time to see whether or not there would be a change. It's totally reasonable for employers to now say, you know what, we've looked back over the last few months, there's been no change. We know that COVID is extremely volatile. We know the only way that we can truly prevent risk to health and safety for our employees is for our employees to be vaccinated. Therefore, we're now taking the decision to require all employees to be vaccinated. It's a completely reasonable step, and certainly you might have some employees who do say, oh, well, why is this suddenly an issue? And you take them back to the rationale, which is that this is a constantly evolving thing. And we have to deal with the risk to health and safety as it is in front of us right now. And this is how we're doing it.
Yeah, no worries. Okay. So another thing that when someone said, have you got a rat? It wasn't, people thought of a little creature and go, no, that's not great. Now a rapid antigen test. So they're getting handed out at schools. No one could find them in January, but now there's a few more around. So Sarah, can you require your employees to produce a negative test before they come back to work?
Yeah, so I guess the short answer is yes, but like most things, the devil is in the detail. So you'd want a direction will need to be made by the employer, and that direction needs to be given in writing, referencing OH&S obligations as the basis for making that direction if an employer chooses to require a negative rapid antigen test. Generally, the best practice is that there's written direction that references the basis for the decision, explains why it is reasonable, and then also sets out the consequences of a failure to comply. Now, if you are requiring staff to produce a negative rapid antigen test, you'll need to ensure that you provide the test and ensure that tests are always available. In terms of how it's managed, there's different ways, and it's going to be specific to how many are in the workforce and what are the associated risks. It might be that they show their test results and then a registry is created and they're ticked off that someone has cited the test results prior to commencing work. You'll also need to have consideration around, well, what happens when the test result is positive? And so the worker might, not come into work, and whether or not working from home is appropriate, or if they get a positive test result, but they're feeling unwell, it may be that, they need to take some personal leave if they've still got personal leave. So just having regard to whether they're, experiencing symptoms, if they're feeling unwell, or whether it's just a positive result without the other side effects.
Can I just go back a step? So that was quite specific for an employee, but do you think as a business, should they be sending, so there's a general email out to the whole business telling them that you want them to do a test before they come back into work? Is that what you, so that's the first step is a general thing rather than a specific email to a particular employee? Yeah,
definitely. So definitely having a general direction shared in writing, shared with the entire workforce, what the expectations are. and also what the consequences of failing to comply is.
Okay.
So
then you've got to provide them with the tests if they need to have the test. So because it's obviously tricky to get them sometimes in some places. So
yeah.
Okay. And
So,
if they're unable to do it?
So if they're unable to produce a rapid antigen test, you've got to ask why. What's the reason? Find out. Don't make assumptions necessarily that they didn't want to do one, so they couldn't. So it is very specific to the circumstances of that employee. So once you've made inquiries, if they were unable, they didn't have any more tests at home that you had provided, it might be that they come into the office and get a test and do it as soon as possible. But if the employee, at no fault of their own, was unable to do the test and provide a negative result, then they could either, if it's possible, work from home, or if they're not able to work from home, but they're not able to attend the workforce, then they shouldn't be, docked of any pay or anything like that, where them not doing the test was not at their fault. And then that's somewhat different to if an employee refuses to take the test, or they refuse to provide you with the test result. So in those circumstances, where you've implemented a policy that sets out the framework of why it's a reasonable and lawful direction, and you've given that direction to the employees to be tested, then you may treat such refusal similar to a refusal to follow a reasonable and lawful direction and commence a disciplinary process. So Catherine touched on a little bit of that before, which is similar to where you've made a mandatory vaccination order and your employee fails or refuses to comply. So a similar process needs to be followed, like you'd follow in any decision by an employee not to follow a reasonable and lawful direction. So you might, by commencing the disciplinary process, it's important that it's managed really fairly and in accordance with all existing laws. So otherwise it might give rise to unfair dismissal, general protections, discrimination claims. And really the proper process of doing that is, making sure you've also explained the consequences of them failing to comply. Based on their response and the reasons that they've given, taking that into consideration before ultimately coming to a decision.
Yep. I'm just going to loop back slightly. So when on the unable to provide the test because they can't get access to them, could you actually, and you're saying if you've got them in the office, can you make them come into the office to get one, or is that?
Yeah, so it's going to be really specific and circumstantial to your industry. So for example, if people have been doing a mix between working from home and working in the office, but you do have a direction that if you are going to come into the office, you need to provide a negative test, then in that circumstance, it would be unreasonable to say, okay, well, today you must come into the office just to pick up the test.
Yep.
If they were otherwise able to work from home, unless there's like agreed days that they were coming into the office, then it might be, if their day was, for example, like in the BlueRock Law team, we have set days, which is a Wednesday, and that person said, oh, I don't have a test at home, so I can't come in. Well, in that instance, you could say, well, that was your expected day to attend the office face-to-face. It wasn't one of your work from home days, and we have tests available. You're able to do the test prior to commencing work, and you're really able to manage the risk of them. They would wear a mask, upon entry, do it straight away before they make contact with any other employees, or use the common areas like the kitchen or the bathrooms. So in terms of risk mitigation, them doing it at home or first thing upon arrival into the workforce, it's a relatively low risk that they'll, cause a mass exposure within that short time period.
Yeah, Cool. Now I'm going to loop back a little bit. So thanks, Max, for the question. Both Sarah and Catherine have talked about what about breaching a contract and stuff. So Max's question in the chat, and I'll go to you, Catherine, for this one, but breach of contract, do you need them to have signed a new contract and talk and include clauses around vaccinations or clauses, as Sarah's talking about, requiring RATs? Or is it okay for, most people are going to have some form of contracts in place?
Yeah. So look, it's for new contracts, as a matter of course, we're including COVID terms in them, but you don't need a new contract to deal with this. You can simply, most contracts provide for, and certainly the common law provides for the contract to be amended in writing, and it's sufficient to write to the employee in the form of a letter or an email, setting out what the direction is. Obviously, not every single direction that employers give employees is set out in their employment agreement. You might direct your employee to go and get a cup of coffee. That's not in your employment agreement, but nonetheless, you can give a direction. So really, all that's required is that that the direction be given in a clear and unequivocal way. In terms of the contracts, though, no, you don't need new contracts just because of that. But I think one of the things that we're finding is that the whole sort of COVID situation has given everybody a bit of time to sit back and look at their contracts and see whether, okay, it may not contain COVID. That's not necessarily the only reason to review your contracts and make sure that they're compliant. The issues that we face in this sort of new COVID world has shone a light onto maybe some of the areas that our contracts of employment can be improved.
Yeah, okay. Thank you. And Bronwyn's got a question there, which Sarah, on one of the things that you touched on, but that's a similar thing. Like, does the not being penalised payment you mentioned for employees, does that extend to subcontractors if it's not their fault?
Yeah, so it's going to depend what's in your subcontractor agreement. Contractors are treated very differently to employees. Employees are afforded much more protections under the Fair Work Act. And that's why we say, it wouldn't be fair for an employee to be penalised financially if they were unable to provide a negative test result at no fault of their own. So it's a very different relationship structure between employee and employer. Whereas with a contractor, its payment is usually, and again, it depends what the agreement says, but it's usually based on producing a certain outcome and providing a particular service, which in that case, they would be unable to comply with.
So Bronwyn, is that all right? Is that, yep, all good? So yeah, and I think Trudy's got a question. I'll look back to you, Catherine, on this one about the communicating the vaccine mandate within the recruitment process.
I love this question because I love, as an employment lawyer, I get so excited about people thinking about how do we get things right from the very beginning. So in terms of how you communicate it in the recruitment process, you can include it as, when you put together your advertisements, for example, whether it's on Seek or however you do it, you set out the sort of selection criteria. You might include it in those selection criteria. You can also include it in the blurb about your business. The reality is that being proactive at protecting your employees is something you should be proud of. And so it has every place to be as part of your sort of business statement in the recruitment process. And obviously, if you are a workplace where you have a COVID vaccine mandate, then someone who is, say, for example, an anti-vaxxer, they're probably not going to sit well in your business. And it's important that you're communicating really well to prospective employees as to what your expectations are going to be. And COVID-19 vaccination is just one of those expectations. And also, I suppose, too, if you're using a recruitment company, you would make it one of the criteria that they assess when recruiting for the role.
Thank you. So, Trudy, hopefully that's enough on that one for the time being anyway. We might just keep going on. So what about COVID positive people? So all the rules around that. So, you've got an employee who's and an exposure site, and they want to take leave and they don't attend work, Catherine, what do we do about that?
So obviously there'll be requirements in terms of, managing if they've been at work whilst exposed, but those are pretty well articulated in the various government websites, and certainly if anyone needs to be pointed in that direction, I'll include them on the information we send you after. But in terms of the employee entitlements, the employees your first stop is they've got COVID, they've got a positive COVID test, they need to go home, number one. Number two, because they've actually got COVID, they are entitled to use their personal leave because they're not fit for work. And they won't be fit for work until they've completed their quarantine. Now, this applies whether they're symptomatic or not. The fitness to work question is really determined the point at which they have the positive test result. So they're able to access their personal leave. They are also, however, and I have seen a few instances of this where people have contracted COVID and therefore have an entitlement to a government benefit. Sometimes employees are electing to take the government benefit and not to use their personal leave or their annual leave. That's totally fine. That's entirely up to them. But certainly that is what personal leave is there for if you're unwell and you can't work. If they have exhausted their personal leave and they want to use their annual leave, that's really up to, as the employer, a decision to make. Annual leave represents a liability for employers. So if an employee wants to reduce that liability, then that's probably not a bad thing. So yes, so essentially they can use those different leave options. If they, for some reason, have no personal leave and no annual leave, and they can't attend for work, then they have to take unpaid leave. But then at that point, they are also able to apply for the government disaster payments and benefits. Okay, so just on the money side of things, so does the employer have to pay the employee if they're getting tested? So like, I know not as many people are getting PCRs now, but there was a time where it was taking quite a while to get the results. Up to 5 days in Victoria. Do they have to pay, while they're being tested? Yeah, so employees are entitled to be paid whilst they're obtaining a test. And obviously that if that is 5 days while we wait for PCR results, that's the case. But now obviously we've got the use of the rapid antigen, which can be helpful to kind of mitigate that exposure in terms of paying someone for not working. But if you're requiring someone to take a PCR test, then they're paid for the duration of taking that test and getting the results. And then once they've got their result, if it's positive, they then go on to personal leave or annual leave or unpaid leave, depending on the circumstances. And is that, situation that I mentioned earlier, I've had, 3 of my kids test positive. There was a week in isolation and then I had my wife test positive. And so I've had 2 weeks in isolation. Should I have been paid? Well, it depends if you can work from home, I suppose. If you have to isolate because you're a close contact, and so that's a government requirement, you can use your accrued annual leave during that period if you want to. If you're only a close contact and you don't have COVID, there's an issue then of whether or not it can be considered personal leave. Now, if in your case, Bruce, where you had people in your family who were also sick, you may not have been able to take personal leave, but you could have taken carer's leave because providing care to a member of your immediate family, that's what the carer's leave entitlement is for. So it might be that if that's the case, sick children or relatives that require care, then as an employee, you can certainly give access to carer's leave as well. And again, it comes back to, the kind of allowances you're prepared to make. It might be that you decide, look, the person's got no annual leave. They have got accrued personal leave. We're prepared to give them their accrued personal leave because we don't want them to go without pay. Then that's a commercial decision for you as an employer. And certainly there's no obligation to do that, but certainly in terms of maintaining team morale in a time where it can be quite difficult, that's certainly an option for employers. Cool, thank you. I'm going to get to the questions from Greg and Jamie in a sec, but just one last one on this topic though.
what sort of proof do they need to provide you to their employer? So if, you know, do you need, obviously you can take a photo of your rat test, you'll get a text for your PCR, but the photo of the rat test, there's some interesting photos coming through, I know, amongst in WhatsApp groups with my mates. So what evidence are people providing, and what can you actually ask for?
Sure. So the Fair Work Act only requires that an employee provide evidence that, or reasonable evidence that would satisfy the employer that they're unfit for work. So the expectation isn't that you consider that every employee is trying to trick you and therefore using Joe Blogg's positive rat test down the road so that they can, you know, spend some time at the tennis and not work. It doesn't have to be that complicated. It's sufficient if the evidence that the employee is giving you, you're satisfied on its face that evidence is real. Now, if for some reason you have an employee who seems to be having to take rat tests because they've been repeatedly exposed, say every single week on a Monday, for 4 weeks in a row, I'd say you've probably got a performance issue on your hands. That's when you might say, okay, well, we're a bit concerned that that the rat is being abused. And in those circumstances, that's when you would actually enter a performance management process, and you'd write to the employee and say, look, we're concerned about your behaviour, and go down that path. But as a general rule, as long as the evidence that you're given, you're satisfied that it evidences that they're not fit to attend for work, then a text with a positive rat test or a negative rat test, depending on what you're doing, a copy of the government text message, those would all be considered reasonable.
Okay. Jamie's got a question about, can you request an employee to work from home while they're waiting for test results, assuming they've got the tools at home to work? Yeah.
So I would say yes. And then the only exception to that is if the employee is unwell. And it's a really probably tricky area now that we're also sort of ensconced in working from home. But the obligations to ensure the safety of your employees obviously extend to working from home. And that's not just that they don't climb a ladder and fall down it, or that their chairs are set up and their desk is set up correctly. It's also if the employee is actually genuinely too unwell to work, such that they're not coming into the office because they have got full symptomatic COVID, you do need to think about whether or not giving them that direction to work from home whilst they're sick is reasonable. And for the most part, most people can moderate that and make that decision themselves. But it is something that, at least as sort of responsible employers, that we should consider before giving that direction. But yeah, the short answer is absolutely they can work from home, providing that they've got the ability to do so.
There's a slight variation on that. You're talking about if someone's actually sick.
Yeah.
What about it? So if they're sick and they've got a rat test and then they're negative, can you send them to get a PCR test if you're like, surely you've got COVID?
Yeah. I would say that would be a reasonable and lawful direction in circumstances where, if they're very symptomatic, we're all very aware of what the symptoms of COVID are. And we're also aware that we're not scientists or nurses who are used to administering rat tests. So there is a high level of false negatives that if you're still concerned, it would be the proper thing to do would be to direct them to obtain a PCR and to pay them whilst they go through that process.
Yep. Cool. And sorry, looping back to Greg's question about states mandating that employers demand vaccinations or negative tests. Is there any state laws that are around this?
So obviously in the aged care and health sectors, vaccinations are required before anyone can attend for work. In terms of negative tests, in aged care and in some healthcare settings, they can, but those are very specific industries. There's certainly no blanket obligation in any state. Like every single employer in, Victoria must have negative rat tests before people can return to work. No, and in part, I would think it is very unlikely we'll get to that stage given the short supply of rats in the market at the moment.
Okay, we'll change topic just for a minute now. So public health order exemptions. So Sarah, what are the current requirements or restrictions that employers need to be aware of?
So with the public health exemptions, so similar to those industries that Catherine actually just mentioned, so the aged care facilities, daycare, there's a few others, the hospitality workers, disability workers, ambulance workers. On the 13th of January this year, Victoria announced that those industries could exercise their discretion to use some exemptions. So it's not a requirement, it's not a mandate, but it's an exemption that is available. So if under certain conditions, workers may return to work if it's necessary for the continuity of operations and if other options have been exhausted. So the exemption will apply to attending work only. And a really critical thing as well is that both parties must consent. So, for example, in the hospital setting, you won't necessarily have them being able to, the employees will also have to consent. So how it will work, they'll put their employer on notice that they're a close contact and that their status is now that of a close contact, and then they'll have a discussion with the employer if it's, having regard to the business needs and the continuity of the operation, whether or not they're required to return to work. And it's got to be by mutual agreement. So what we're seeing practically is in a lot of these cases, employers do not want employees who have been close contacts to return to work because you could potentially contaminate the workforce, and then you're putting yourself in a position where there's many more employees who are unable to attend work. And the other thing is that there are strong measures that are required to be followed to mitigate any risk of a close contact attending work while infectious. So those additional risk mitigation, the worker must undertake a daily rapid antigen test for 5 days and return a negative result prior to attending work each day. They must wear a mask at all times, with exceptions in the case of eating or drinking or safety reasons. The worker cannot enter a shared break area, and the employer must try and facilitate solo break times. The employer must also take reasonable steps to deploy the worker in areas where transmission is at lower risk. And if at any time the worker develops symptoms or they test positive, then the exemption no longer applies.
So if you're in an industry that it applies, how do you manage that for a particular thing for your industry compared to the general exemption? So
if that exemption applies in your industry, there's really nothing that you need to do unless you want to exercise that exemption. So for example, if you do get a phone call from an employee saying, I'm a close contact, and the rules around close contacts have also changed. So, close contacts, otherwise known as a household or household-like contacts, are people who have been spent more than 4 hours with a case inside a house, accommodation or care facility. So if you get that phone call that they're a close contact, then you as the employer can make that decision whether or not you want to consider exercising that exemption. And again, you'll think about what the business looks like on that day or on that week. It's going to change from week to week, depending on how many people have called you being a close contact or how many people are otherwise away with COVID. So it's something that you just need to exercise at that particular time with the information that you have in front of you at that time. But remembering that that exemption, you can't require the staff member to attend. It has to be by mutual consent.
Okay. We might jump back to, we've got positive in COVID matters. What about if, Catherine, if the person contracts COVID at the workplace, and that's pretty clear, is the company, like as an employer, are we liable for that?
Yeah, potentially. That's the bad news. The good news is that that there is a work cover scheme that will help. So contracting COVID in the workplace is like any other workplace illness or injury. It's just unfortunately one of those more common things that people, that employees are more likely to contract. So the courts have considered this, and they have found that that COVID is an injury for the purposes of the workers' compensation scheme. Whether or not an employee then makes a work cover claim is an entirely separate issue. But in theory, yes, you are liable as the employer. Now, in terms of how involved, for example, WorkSafe would get, and obviously when it comes to illness and injury in the workplace, there are sort of two issues that employers face, or three, including the safety of employees, but those are the involvement of WorkSafe, and then the second one is the involvement of work cover, and obviously having to make claims under your policy increases your premium each year. You'd like to try and avoid it, and that's why as much as you can do to minimize the risk of employees contracting COVID in the workplace, that's always going to be a commercially sensible thing to do, not to mention the right thing to do, but a commercially sensible thing to do to avoid having to cop an increased premium. And look, in terms of WorkSafe, I think ultimately WorkSafe will start to investigate, particularly where there are large outbreaks of COVID in workplaces, to ensure that the businesses are taking every reasonable step to protect the health and safety of employees. But I think also the reason that we haven't heard a lot from WorkSafe is that this is a global pandemic, and it has reached into every facet of life. And so I think there's a general, acceptance on the part of WorkSafe, at least for the moment, that this is the reality, the world that we live in. But as long as you are doing, you have assessed the safety risks that COVID poses, and you do have a plan in place, and you do have a policy in place, in the event that WorkSafe comes knocking on your door, you're able to demonstrate that you are compliant.
Okay. Just around sort of managing your staff as well. So if does your staff have to tell you, like in my case, would I have to tell the employer that my kids have got COVID? So I don't have any symptoms, but I'm living in a house with COVID.
Well, you are in essence a close contact, and it would be, and that's where the COVID policy comes into its own, really. And because in that policy, you set out what your expectations are for your employees. And one of those would be having employees report circumstances where they are close contacts. And that way you're able to manage the safety of the workforce and the employees' health and safety specifically. So have a policy that says, exactly that. If you're a close contact, you must notify us, you must get tested, and you must quarantine for the specified period. And if they don't do that, then back down a disciplinary path.
And if they come into work and they've got symptoms, so I don't have people at home with COVID this time, I'm just sick. Can we send the people home if they come into work sick? Absolutely.
So we keep saying it, but the work health and safety obligation to provide a safe place of work gives employers a really broad discretion in those sorts of circumstances. They have to assume if you're coughing and spluttering that you may potentially have COVID. So it's an entirely lawful and reasonable direction to say, go home and get tested. And certainly, once they can produce a negative test, then they can come back to work.
And we, as the employer, can we collect all this information around, if people have got COVID, they're close contacts, or they've, had tests, all these things that we're talking about here? Can we collect that information? And I guess if we can collect it, what can we disclose about it to other people?
So I would say you should err on the side of not collecting data, because you need to make sure that any collection of data falls within the requirements of the Privacy Act. And that can be complicated. So if you are in an industry where you do need to collect that sort of information, there's lots of processes and there's a lot of systems set up that can help you do that safely and compliantly. But generally what I would say is you don't need to record private medical information. It's sufficient to, if someone sends you a text and says, I can't attend for work because I've got COVID, that could go on their personnel file, but you don't need to store any more information other than that. That's no different to someone, sending in a medical certificate because they've broken their leg and they can't come to work.
What about the vaccination certificates? Is that in the same category?
So vaccination certificates can be stored,
Yep.
but they do need to be stored in compliance with the Privacy Act. So what I will do, because the Privacy Act is really interesting to me, but maybe not so interesting to everybody else, I will include some information in what we send out after today on the storage of data. But it's really important that, we understand that there is a very high level of importance and confidentiality around private medical information, and that it is treated confidentially. So you can't sit down in the break room and say, oh, everyone, do you know that Joe Bloggs has got COVID again? You really shouldn't be discussing. It's different if he sends everyone an email and says, I've got COVID again. But as the employer, you mustn't discuss your employees' medical information.
Yeah. Okay. We're going to loop back on the mask question. So Bronwyn's got a question in the chat, Sarah, for you about removing masks because of safety concerns, and in an environment such as a commercial kitchen. How does that play out?
So with the mask requirement, if it's, I'm actually not 100% sure in the industry of like a commercial kitchen what the specific requirements are. So we'll probably maybe get back to you on that when we send out our information pack. Yeah, just in regards to a commercial kitchen.
Can I jump in, Sarah? The issue around masks and when you don't have to wear them, and whether the safety of one situation or the lack of safety outweighs the risks of the other, it's very tricky. The presumption under the mandates around masks is that masks are worn at all times in whatever setting that they're required, and that there are specific exceptions to that. If from a health and safety perspective, that there was a risk that the person is going to pass out because they're so hot, because they're in a commercial kitchen or they're in a very hot area, then purely from a work health and safety perspective, you could remove the mask, particularly if you're then able to implement other measures. So I would say before we have everybody taking off their masks, you have to ask, can we improve ventilation in the kitchen? Can we make sure that if we are going to let people take off their masks in that environment, that we are maintaining social distancing? What are the other steps that we can take to avoid the necessity for removing the masks in the first place? Really, there's a lot of situations in employment where you'll have competing safety concerns, and it really is about sitting down and going through and assessing each risk and what you can do to mitigate it, to try and get to a point where you can actually do both things safely. And then obviously what you need to take into account, which we will look up for you, is, are there any exceptions that apply in these circumstances?
So we'll get back to Bronwyn. So now sort of turning to a harsher side of it a little bit, but someone's got COVID, they don't have they're not on personal leave, they're not on unpaid leave. So Catherine, can we terminate them?
Just because they've got COVID?
Well, because they can't attend work.
Okay, no. So having COVID, even if you don't have leave entitlements, doesn't mean you can just terminate their employment. They're entitled to be on unpaid leave. I'm assuming that that their COVID won't last for 3 months or more. But if it was to, after 3 months, if they hadn't returned to work, then you can look at whether or not the employment can be safely terminated. But if you were to terminate someone for having COVID, I think that you would find you were on the wrong end of a discrimination claim. Yeah.
And you've mentioned a couple of times around COVID policies for businesses and stuff. And so what sort of best practice in terms of putting a policy in place and sort of rolling it out, the policy, given that it's a changing landscape all of the time, the policy is probably going to may need to be updated regularly.
Yeah, look, policies can be both really helpful, but also the bane of everybody's existence, because when you want them, often they're not there. And when you don't want them to be there, they often are. But in terms of COVID, I think that the best kind of COVID policy is one that doesn't try to be too specific and that is reviewed regularly as against any changes that arise or further developments in the science around COVID, for example. So what I would suggest is that certainly when we're drafting COVID policies for employers, the first question to ask is, what are we trying to achieve by this policy? Are we going to set the expectations in terms of how we manage COVID risks in the workplace? Things like, if you are a close contact, you have to let us know. If you are a close contact, you have to quarantine. If you are a close contact, you need to take a RAT and notify us. We require vaccination, that you must wear a mask, that you must sanitize. All of those sorts of things would be included in that policy. I think you want to be careful about going too much further, because as you said, Bruce, you're probably going to find that you're rewriting it. The really important thing though, and this applies to policies, whether it's an anti-bullying policy or a sexual harassment policy or a COVID policy, if you make any changes, it is essential that that new policy is communicated to staff and it's not just updated on the intranet and forgotten about. Because what the case law shows us is that employees can really only be bound by policies that they know exist. If they don't know that you've got a COVID policy and then you need to take disciplinary action against them because they failed to do something, you might find that you fall foul of being able to enforce that policy because they just didn't know that it was there. And the courts have generally accepted that it's not enough to say in the contract that the employee must keep abreast of changes to the policies. Where there's a significant change to a policy, it's really on the employer to ensure that they've communicated that change. And for something that takes 2 seconds in an email, please see attached new policy, please read it and return, either reply to this email or sign a copy and send it back. That gives you a great deal of certainty.
Okay. So a lot of businesses had trouble finding staff over the break because a number of cases in their business. And I know going down to the Surf Coast, there was most of the businesses in Torquay seemed to be shut around that time. So that's obviously having impact on those businesses to operate. And I know this is going to play out across other industries more than just hospitality. But so the business, they're affected financially in a big way because of not being able to operate, either because, lockdowns, but probably less so lockdowns now. It's just people testing positive in their business. So can they ask their staff to take pay cuts? Can they ask or reduce their hours while they get themselves back on track?
This is a yes and no question or answer, Bruce, I'm afraid. The impact on organisations is big, and what we're seeing is both a need for businesses to make employees redundant. They simply don't need 15 staff anymore. They only need 5. They, less so perhaps now, although certainly hospitality, this might still be an issue with, the current spread rates. But you can certainly ask an employee if they would mind terribly taking a pay cut or reducing their hours, but you cannot force them to. So if you sit down your employees, and certainly there were a lot of packaging companies that did this early on in COVID, where they sat them down and they said, look, in order for us to stay afloat and for everybody to have jobs, we need to reduce our overheads. And so we would like people to take some annual leave, and we'd like people to reduce their hours. And so they consulted with the employees in such a way as that it was a very open conversation, and there was no pressure. So there was no obligation to agree. And in those circumstances, you know, there might be employees who are like, yeah, actually, I would love to swap to a 3-day week from a 5-day week. That'd be great. In which case, that's absolutely fine. Where it becomes an issue is when you say to Joe Bloggs, sorry, you're going from a 4-day week to a 1-day week. And it's a unilateral change. And what that has the effect of is repudiating the employment agreement and terminating his employment. And that then gives rise, well, for him, he can either claim unfair dismissal or seek damages against the company. So it's all about those sorts of changes around, you know, directing people to take leave, reducing hours, or reducing pay. It needs to be by agreement, and the agreement has to be free, and the courts are absolutely brutal about this. There cannot be any kind of coercion or influence applied or pressure applied.
I've got a couple of questions on that topic, but Max has got another good question around vaccination. So we'll look back to that in the chat. But yeah, someone refuses because of health concerns, gets vaccinated, and something they can show that there's something that's caused them problems. You know, what sort of recourse can they have on the business?
Okay, so this is someone who was worried about getting vaccinated, got vaccinated because their employer said they had to, and then they've had an adverse health event as a result of the vaccine.
Yeah.
That's a very unlucky individual. I think that there is potential liability at the hands of the employer, where the employer has directed the employee to have the vaccine. I think that we haven't seen any of these play out through the courts yet, and that's likely because cases are not getting listed until next year now. The pharmaceutical companies that produce the vaccines have a relative indemnity in relation to the side effects. So normally when a person takes legal action, they're advised to go after the entity with the deepest pockets, which would be the pharmaceutical companies, but here they're not going to get any relief. So then it would fall into the category of, is this an injury that's compensable by work cover? In which case then it would go down the work cover path. And then if not, if it's an injury that's not covered by work cover, it would be some kind of personal injury claim, but joining the employer. So, I mean, I hope for all of the employees' sake that it doesn't become an issue, but potentially, yes, an employer could be liable.
Yeah, that would be unfortunate for everyone concerned, particularly the person who's ill, but also for the employer. Yeah,
absolutely.
We're right. Yeah, Bronwyn, you're right. It's a scary situation. Now, thank you. We're right on time now, so I might just wrap it up. We have got lots of other questions that we could cover off. That a collection of questions that Sarah and Catherine have been asked over the last 2 months from various different clients of ours over the journey. So if you've got any other questions that we didn't get to and you didn't put them in the chat, please feel free to send them through. We're happy to answer those. As Catherine mentioned, we'll put some materials together to send out for you on some of these commonly asked questions, some of the categories. But firstly, thank you to Sarah, thank you to Catherine for putting all the materials together and presenting today and educating all of us further. Thank you.
Thank you.
And thank you to everyone for joining today as well. So taking some time out of your day to jump on this webinar. If those who weren't live and watching the recording, thank you also.
Absolutely. And thank you everyone from me, and please do sing out. You've got, I think, our contact details if we can help in any way during this very messy and confusing time. I will try and do better than answer with yes, but maybe no.
Thanks a lot, guys. Stay safe.
Thanks, everyone. Bye.
Thanks. Bye.